Hello everyone, my name is Neetu Dalal. Welcome back to my YouTube channel called Edu Classes, where we watch, learn and excel. We have been doing chapter 5, Therapeutic Approaches. We've already covered video 1 of this chapter, wherein we have discussed topics of nature and process of psychotherapy. We'd also started with types of therapies, and we have covered psychodynamic therapy in chapter 5, part 1. So in today's video, we will be primarily focusing on the rest of the therapies, which is your behavior therapy, cognitive therapy, humanistic existential therapy, biomedical therapy, alternative therapies, and we'll also look at some of the how rehabilitation of mentally ill is done. So without wasting any more further time, let's get started. So the first behavior therapy that we will be looking in today's video is your behavior therapy. Behavior therapy states that psychological distress arises because of faulty behavior patterns or thought processes. This we have already discussed in previous chapters as well, that behavior therapy is basically to do with the patterns or the faulty patterns in your behavior which exist, and it is therefore focused on behavior and thoughts of the client in the present. Behavior therapy also, like psychodynamic therapy, doesn't like psychodynamic therapy focuses on your past. Opposite to that, your behavior therapies focuses on what's happening in the present with the client. The past is relevant only to the extent of understanding the origins of the faulty behavior. Yani, we only look at past in behavior therapy to an extent when we are trying to understand ki jo aapka faulty behavior hai, from where is it arising. But we do not work on the past, we work on the present and the present issues of the client. Only the faulty patterns are corrected in the present. Behavior therapy consists of a large set of specific techniques and interventions. Like any other therapy, behavior therapy also has some of its specific techniques and interventions that can be used. Interventions basically means some of the things the therapist does with the client, which helps the client to deal better in the present scenario. The symptoms of the client and the clinical diagnosis are the guiding factors in the selection of specific techniques or interventions to be applied. Yani, how do you decide, or how does the therapist decide ki out of so many specific techniques and interventions present, which one has to be used? तो इस आंसर पे थेरेपिस्ट अराइव करता है ऑन द बेसिस ऑफ कि क्लाइंट कौन से सिम्टम्स से जूझ रहा है, एंड सेकंड कि क्लाइंट का क्लिनिकल डायग्नोसिस क्या आया है. क्लिनिकल डायग्नोसिस मतलब what has come out to be the problem when the client was judged and seen ki what is the issue. It's a clinical diagnosis is a complete another process. Depending on what are the symptoms and what the diagnosis says, based on these two factors, your therapist decides one technique or two if in case that works better. This depends on situation to situation, and on the basis of these two factors, your intervention is planned for the client. Treatment of phobias or excessive and crippling fears would require the use of one set of techniques, while that of anger outburst would require another. यानी डिपेंडिंग ऑन द प्रॉब्लम आपकी जो सोल्यूशन है वो वेरी करेगा. यानी अगर आप फियर को ट्रीट कर रहे हैं, या इफ यू आर ट्राइंग टू ट्रीट फोबिया ऑफ अ पर्सन, the techniques you used here would be very different in comparison if you're trying to treat the anger issue of a person. Therefore, depending on the problem at hand, different solutions are used in behavior therapy. A depressed client would be treated differently from a client who's anxious. In the same way, somebody who's depressed will be treated or will have a different solution or a different treatment plan in comparison to somebody who has anxiety. So therefore, depending on what the symptoms are, what the diagnosis, clinical diagnosis is, and what is the problem at hand, different techniques are applied, which are very customized according to the client's problem. Now, what are some of the methods of treatment in behavior therapy? The client with psychological distress or with physical symptoms which cannot be attributed to physical disease is interviewed with a view to analyze his or her behavior patterns. यानी जो first step होता है वो ये होता है कि आप जो client को basically you're trying to interview the client ताकि आपको उनके जो behavior patterns हैं या behavior के जो there are certain set of behaviors उनको आप analyze कर पाएं. So this is the first step. You sit down and you somewhere in a way sort of interview or try to talk or converse with the client so that you are able to judge that what is the behavior pattern of the person. Behavioral analysis is conducted to find malfunctioning behaviors, the antecedents of faulty learning, and the factors that maintain or continue this faulty learning. यानी behavioral analysis करना इसलिए भी जरूरी है ताकि first आप malfunctioning behaviors को identify कर पाएं. Malfunctioning behaviors यानी वो behaviors जो अब आपको function करने में help नहीं कर रहे हैं and they have become a problem in your functionality as an individual. वो आपको अपनी day to day life में they are creating issues for you. So these kind of behaviors are known as malfunctioning behaviors. तो पहला तो जो behavioral analysis का aim है वो ये कि जो ऐसे malfunctioning behaviors हैं वो identify हो पाए. Second, what are the antecedents of faulty learning? Antecedents मतलब कुछ ऐसी चीजें जो basically which are somewhere originating that problem, and also to identify factors that continue that faulty learning, right? So they have now clinically defined it. Malfunctioning behaviors are those behaviors which cause distress to the client. Antecedent factors are those causes which predispose the person to indulge in that behavior. Yani initiating factors, we can refer to them as your antecedents. Maintaining factors are those factors which lead to the persistence of the faulty behavior. यानी आपके maintaining factors वो factors होते हैं जो आपको are the factors which are still helping you, which or because of which you are still continuing indulging in that behavior. So behavioral analysis majorly has three goals. First is to identify your malfunctioning behavior, to find out what is the antecedents of your faulty behavior, and third, to find out why you're still indulging or maintaining, or what factors are leading for you to still indulge in that behavior. So now the method of treatment. So for example, if we take an example of a young person who has acquired the malfunctioning behavior of smoking, यानी over the interview आपने जब client से बात की आपको ये पता चला कि जो default या फिर जो faulty behavior है वो smoking का pattern है, and he wants to seek help to get rid of smoking, right? He's smoking in present and he wants to get rid of this malfunctioning behavior. So आपने behavioral analysis से आपको ये पता चला कि जो faulty behavior है वो है आपका smoking. Behavioral analysis conducted by interviewing the client and the family members reveals that the person started smoking when he was preparing for the annual examination. यानी client और उनके family members से बात करके आपको ये पता चला कि उन्होंने when did the person started smoking? When he was preparing for his exam. He had reported relief from anxiety upon smoking. He felt that he felt better after he had smoked. Thus, anxiety provoking situation becomes the antecedent factor. यहाँ पे ऐसा कोई भी situation जहाँ पे anxiety हो रही है वो आपका antecedent factor या originating factor बन जाएगा. The feeling of relief, यानी smoke करने के बाद the kind of relief that he felt here becomes the maintaining factor, because the person feels that smoking is helping him to calm down, and therefore this becomes the maintaining factor for him. The client has acquired the operant response of smoking, which is maintained by the reinforcing value of relief from anxiety, right? So यहाँ पे हमने in this example we've identified three things. First, your faulty behavior is your smoking. Your antecedent factor is any anxiety provoking situation, and your maintaining factor is the fact that after smoking the person is feeling a sense of relief. Now, so once the faulty behavior which causes distress have been identified, a treatment package is chosen. एक बार जब आपको पता चल गया है कि कौन सा behavior faulty है, फिर आप एक treatment की तरफ आगे बढ़ते हैं. The aim of the treatment is to eliminate the faulty behavior and substitute them with adapted behavior pattern. Of course, treatment का जो main aim है वो यही है कि आप जो faulty behavior है या जो गलत behavior pattern है उसको आप खत्म कर दें और उसको substitute या उसको replace कर दें एक ऐसे behavior pattern से जो कि ज़्यादा functioning या ज़्यादा adaptive है. The therapist does this through establishing antecedent operations and consequent operations. यानी how do we achieve this goal? Therapist क्या करता है वो एक antecedent operation establish करता है और एक consequent operation establish करता है. Now we will see at or we will look at what these two are. The antecedent operations control behavior by changing something that precedes such a behavior, right? यानी basically जो antecedent operations हैं वो behavior को कैसे control करते हैं? They change something which precedes the behavior. The change can be done by increasing or decreasing the reinforcing value of a particular consequence. This is called establishing operation. Now let's look at an example and understand this. For example, if a child gives trouble in eating dinner, an establishing operation would be to decrease the quantity of food served at tea time, right? यानी क्या कर रहे हैं, what the therapist or what the parent is doing, अगर बच्चा खाने के टाइम पे बहुत चिक चिक करता है या the child is not very interested in eating, so यहाँ पे establishing behavior क्या हो सकता है कि आप जो है बच्चे की खाने की क्वांटिटी कम कर दें ड्यूरिंग टी टाइम, बिकॉज वो डिनर के टाइम पे इश्यूज क्रिएट कर रहा है. ये क्या करेगा, दिस वुड इंक्रीज द हंगर एट डिनर एंड देयरबाय इंक्रीज द रिइंफोर्सिंग वैल्यू ऑफ फूड. अगर आप बच्चे को दिन में कम खाना देंगे तो ऑब्वियसली उसको रात को ज्यादा भूख लगेगी एंड द पर्सन चाइल्ड विल बी मोर इंटरेस्टिंग इन हैविंग डिनर, राइट. और ये जो पूरा टास्क प्रोसेस है ये उसकी फूड की रिइंफोर्सिंग वैल्यू को इंक्रीज कर देता है. Praising the child when he or she eats properly tends to encourage this behavior. अगर बच्चे ने खाना खाया जितना आप चाहते थे, then if you're encouraging or if you're praising the child that well done, then this also will increase his chances of having good dinner in the future as well. यहाँ पे the antecedent operation is the reduction of food at tea time and the consequent operation is praising the child for eating dinner. It establishes the response of eating dinner. यानी आपने एंटीसीडेंट ऑपरेशन क्या एस्टैब्लिश किया, आपने खाना रिड्यूस कर दिया पहले, एंड कॉन्सिक्वेंट ऑपरेशन यानी आपने दो ऐसी चीजें की. वन इज एंटीसीडेंट व्हिच इज बिफोर द बिहेवियर एंड अनदर इज कॉन्सिक्वेंट ऑपरेशन व्हिच इज आफ्टर द बिहेवियर. बिफोर द बिहेवियर आपने क्या किया, यू रिड्यूस द फूड. व्हाट डिड यू डू आफ्टर द बिहेवियर, आफ्टर ही हैड द डिनर, यू प्रेज्ड द चाइल्ड. So these two operations actually help in achieving the adaptive behavior pattern that the therapist is aiming to achieve. Now, some of the behavioral techniques which are available for changing behavior are, the principles of these techniques are to reduce the arousal level of the client, alter behavior through classical conditioning or operant conditioning with different contingency of reinforcement. Basically, जितनी भी techniques available हैं behavior techniques में, उन सबका पहला जो गोल होता है that is to reduce the arousal level of the client. For example, if the client is very anxious, so we are aiming to reduce the anxiety level, right? And change behavior through either classical conditioning or operant conditioning, right? I am sure by now, because we've covered these chapters, so everybody is very familiar with what is classical conditioning and what is operant conditioning. Negative reinforcement and aversive conditioning are the two major techniques of behavior modification. Behavior modification मतलब जो behavior है उसे आप modify करने की कोशिश कर रहे हैं, and इसमें जो दो major techniques हैं वो आपकी हैं negative reinforcement and aversive conditioning, right? So what is negative reinforcement? Responses that lead organisms to get rid of painful stimuli or avoid an escape from them प्रोवाइड नेगेटिव रीइंफोर्समेंट. यानी ऐसे बिहेवियर्स जो करने से आपका कोई पेनफुल इवेंट रुक जाए या कोई ऐसा इवेंट रुक जाए जिसके नेगेटिव आपको कॉन्सिक्वेंसेस मिलने वाले थे, तो वो बिहेवियर भी अपने आप में रीइंफोर्समेंट होता है. फॉर एग्जाम्पल, one learns to put on woolen clothes, burn firewood or use electric heaters to avoid the unpleasant cold weather. यानी हमारा जो वुलन्स पहनने का जो बिहेवियर होता है इन विंटर्स, दैट इज अ नेगेटिव रीइंफोर्समेंट. क्यों? क्योंकि वो हमें कुछ नेगेटिव होने से बचाता है, राइट? अगर हम वुलन्स नहीं पहनेंगे तो हमें कोल्ड वेदर फील होगा एंड प्रोबब्ली वील गेट इल. So to save ourselves from this negative consequence, we wear woolens, and that therefore wearing woolens and keeping ourselves warm work as a negative reinforcement. One learns to move away from dangerous stimuli because they provide negative reinforcement. तो कहने का मतलब यही है कि नेगेटिव यानी अगर आप ऐसे कोई इवेंट में या ऐसे कोई एक्शन में इंडल्ज करते हो जो आपको किसी बुरी रिजल्ट से बचाता है, तो वो जो आपका बिहेवियर है दैट विल वर्क एज अ negative reinforcement and it will increase the chances of you indulging in that behavior again. On the other hand, aversive conditioning refers to repeated association of undesired response with an aversive consequence. यानी aversive conditioning वो होती है जहां पे अगर आप दो चीजों को लगातार लिंक करते रहो. For example, if somebody indulges in having alcohol a lot, right? So what you do, आप अल्कोहल में कुछ ऐसा you mix something जिसके बाद इंसान को वॉमिटिंग होती रहे, right? So whenever the person is having alcohol, he is vomiting. Over a number of association, over a number of times this happening, the person will get completely aversive to drinking alcohol, क्योंकि वो जो अल्कोहल है वो एक नेगेटिव कॉन्सिक्वेंस से एसोसिएट कर दी गई है. इसीलिए they say that aversive conditioning refers to repeated association of undesired response with an aversive consequence. तो हमारे एग्जाम्पल में undesired response क्या है? Drinking alcohol. and aversive consequence क्या है? Of vomiting. They have taken a different example. An alcoholism is given a mild electric shock and asked to smell the alcohol. With repeated pairings, the smell of alcohol is aversive as the pain of the shock is associated with it and the person will give up alcohol completely. आपने इंसान की दो चीजों की एसोसिएशन करा दी है, यानी जब भी वो अल्कोहल स्मेल कर रहा है आप उसे एक इलेक्ट्रिक शॉक दे रहे हो. ओवर अ नंबर ऑफ टाइम, कुछ समय के बाद उसको ये दोनों चीजें बहुत लिंक्ड लगने लग जाएंगी एंड देयरफॉर वो अल्कोहल स्मेल करना या अल्कोहल पीना ही छोड़ देगा. In an adaptive behavior, if an adaptive behavior occurs rarely, पॉजिटिव reinforcement is given to increase the deficit. अगर जो आपका adaptive behavior है वो इंसान कर तो रहा है जो आप करवाना चाहते हैं बट बहुत कम बार कर रहा है या बहुत रेयरली कर रहा है, तो ऐसे सिनेरियोज में आप पॉजिटिव reinforcement देते हैं. एंड पॉजिटिव reinforcement मतलब समथिंग which is positive and which is making the person feel better. For example, if a child does the homework regularly, positive reinforcement may be used by the child's mother by preparing the child's favorite dish whenever he or she does homework at the appointed time. यानी यहाँ पे जो एग्जाम्पल है that is saying कि जब भी आपका बच्चा है, if he rarely completes his homework on time, so whenever he does it, you are preparing him or making him the best his favorite dish. So this is a positive reinforcement for him. या फिर another example ये भी हो सकता है that if you ask the child to complete his homework and every time he completes his homework you give him a chocolate, right? So this also can be a positive reinforcement. Persons with behavioral problems can be given a token as a reward every time a wanted behavior occurs. The tokens are collected and exchanged for a reward such as an outing for the patient or a treat for the child. This is known as token economy. Another technique जो behavioral techniques में बहुत ज़्यादा use होती है is your token economy. And here what generally happens is कि आप for example किसी बच्चे को बोलें that you have to make your bed every morning, right? And every day that you're making your bed in the morning, I will give you 1 token, right? And once you collect 10 tokens, then you can go and watch your favorite movie, है ना? तो आप हर बच्चे को रोज एक टोकन देते हैं and जैसे उसके 10 tokens हो जाते हैं, he can go and watch his movies. Therefore, this is known as a token economy where the child is basically getting an incentive and the person wants to complete his work so that he can collect the maximum number of tokens and then do what he wants to do, right? Unwanted behavior can be reduced and wanted behavior can be increased simultaneously through differential reinforcement. यानी अगर अब आपको दोनों चीजें एक साथ करनी है, आपको अनवांटेड बिहेवियर कम भी करना है, अनवांटेड बिहेवियर बढ़ाना भी है, तो आप डिफरेंशियल reinforcement को भी यूज कर सकते हैं. Differential reinforcement means using your positive and negative reinforcement together in a given ratio. Positive reinforcement for the wanted behavior and negative reinforcement for the unwanted behavior attempted together may be one such method. The other method is to positively reinforce the wanted behavior and ignore the unwanted behavior. यानी differential reinforcement मतलब आप दोनों reinforcement को different तरीके से use कर रहे हैं. तो पहला जो तरीका है वो तो आप ये कर सकते हैं कि आप अच्छे behaviors को positively reinforce करें and negative behavior को negatively reinforce करें, right? The other way that you can do is you can enforce your positive behaviors and ignore the negative behaviors, right? And this method is less painful and equally effective. For example, let us consider the case of a girl who sulks and cries when she is not taken to the cinema when she asked. ऐसा ये बहुत example होता है that we see a lot of young children crying in the malls or creating a scene and they just keep cribbing when they are not given what they want to. The parent is instructed to take her to the cinema if she does not cry and sulk, but not to take her if she does. यानी parents what they will do is अगर बच्चा नहीं रोता है तो वो उसे ले जाएंगे जो वो करना चाहता है और अगर रोएगा तो बिल्कुल नहीं लेके जाएंगे. Further, the parent is instructed to ignore the girl when she cries and sulk. बहुत ऐसे parents, a lot of people advise that अगर बच्चा रो रहा है and if he's जिद्दी, आप उस time उसे ignore करें. अगर आप उस time उसे attention दे रहे हैं, so the child will indulge into in more. The wanted behavior of politely asking to be taken to cinema increases and the unwanted behavior of crying and sulking decreases. जब बच्चा ये देखता है कि जब वो अच्छे से behave कर रहा है and he's not crying and he's being taken to watch a movie, this behavior increases in response or in contrast to when he is crying. Another important behavioral technique which is used is your systematic desensitization. And this was a technique introduced by Wolf for treating phobias and irrational fears. ये जो technique है, ये specifically आपकी irrational डर के साथ treat करने में help करती है, या फिर जब किसी इंसान को अगर बहुत ज़्यादा डर लगता है, whether it is heights or it is darkness, उस सारे cases में systematic desensitization is the behavioral technique that we use. यहाँ पे क्या किया जाता है, the client is interviewed to elicit fear provoking situation, यानी जानबूझकर client को provoking situation के बारे में सोचने को बोला जाता है. And together with the client, the therapist prepares a hierarchy of anxiety provoking stimuli, यानी client के साथ बैठ के एक ऐसी लिस्ट तैयार की जाती है जो सबसे कम डरावने से सबसे ज्यादा डरावने स्टिमुलाई की बात करती है. The therapist relaxes the client and asks the client to think about the least anxiety provoking situation. शुरुआत आप सबसे कम डरावने चीज से करते हो and gradually you move up the ladder where you talk about more and more anxiety provoking stimuli. The client is asked to stop thinking of the fearful situation. If the slightest tension is felt over sessions, the client is able to imagine more severe fear-provoking situations while maintaining the relaxation. The client gets systematically desensitized to the fear. अब इसको समझने का एक बहुत अच्छा example ये हो सकता है कि, for example, if there is a child who is very afraid of a dog, right? The dog is very friendly, very very child friendly, but still the baby, the little baby is very scared of the dog. अगर आप उस बच्चे को एकदम से डॉग के पास ले जाकर खड़ा कर दोगे तो of course he will get very scared and he'll start crying probably. So what you do is, आप एकदम से, suppose if it's 100-meter distance, you don't take the child immediately to the dog. You start reducing. पहले आप उसको 1 meter पास लेकर जाओ, right? 1 meter, make him comfortable. Let him be there for like half an hour. If you feel he's fine, then you take him ahead, more ahead, 2 meters, 5 meters. And you have to make sure that the child is not getting scared at that distance. If he's getting scared, you take him back, right? Or you try another day. धीरे धीरे when the child realizes कि जो dog है वो बिल्कुल harmless है and he's not doing anything, the child will become comfortable with the dog, and this is how your fear are tackled. This is not a one-day process. It takes a lot of time, but this is how systematic desensitization happens. Now, another principle of behavioral techniques is your reciprocal inhibition, right? And we'll see what it means. This principle states that the presence of two mutually opposing forces at the same time inhibits the weaker force. Thus, the relaxation response is first built up and mildly anxiety-provoking scene is imagined. And the anxiety is overcome by relaxation. The client is able to tolerate progressively greater levels of anxiety because of his or her relaxed state. This is what is happening in your systematic desensitization. जो है आपका reciprocal inhibition is happening. Modeling is the procedure wherein the client learns to behave in a certain way by observing the behavior of a role model or the therapist who initially acts as the role model. Modeling is another behavioral technique of behavior therapy. यहाँ पे क्या होता है, basically how somebody learns to indulge in a good behavior is by observing somebody else, whether it is your elder brother or it is your role model, and initially your therapist also can act as your role model. Vicarious learning is the learning by observing others and is used and through a process of rewarding small changes in the behavior, the client gradually learns to acquire the behavior of the model. There is a great variety of techniques in behavior therapy. The skill of the therapist lies in conducting an accurate behavior analysis and building a treatment package with the appropriate technique. So vicarious learning is basically जब आप किसी और को सीख कर देख कर कुछ सीख जाते हो, यहाँ पे भी मॉडलिंग और मॉडलिंग इज द टेक्निक एंड वाइकेरियस लर्निंग इज द प्रिंसिपल बिहाइंड इट, राइट? सो बिहेवियरल एनालिसिस में, बिहेवियरल थेरेपीज में बहुत सारी टेक्निक्स अवेलेबल हैं, एंड जो थेरेपिस्ट की जो एक्सपर्टीज लाई करती है वो यहाँ लाई करती है कि वो बिहेवियरल एनालिसिस करे अपने क्लाइंट का, देखे कौन सी प्रॉब्लम है एंड कौन सी टेक्निक सबसे ज्यादा बेस्ट सूटेड है फॉर दैट प्रॉब्लम फॉर द क्लाइंट, राइट? The next topic we have in this chapter is your cognitive therapy. And cognitive therapies locate the cause of psychological rest in irrational thoughts and beliefs. So, like psychodynamic therapies feel that whatever the issue is lies in your past. Behavior therapy believes that your distress, the reason for your distress is your behavior patterns. In the same way, cognitive therapies locate and they feel that the psychological distress of your irrational thoughts and belief is the major cause of your problem or the stress that you are going through. And Albert Ellis gave rational emotive therapy, which is also known as RET. The central thesis of this therapy is that irrational beliefs mediate between the antecedent events and their consequences. यानी ये जो थेरेपी है ये मेजरली बिलीव करती है कि जितने भी आपके इरेशनल बिलीव्स या जो भी आपके ऐसे बिलीव्स होते हैं which don't have a logic or which are not very rationalized in that sense are coming between your events and your consequences. The first step in your rational emotive therapy is the antecedent belief consequence, that is your ABC analysis. Antecedent belief consequence, right? Antecedent events which cause the psychological distress are noted. The client is also interviewed to find the rational beliefs which are distorting the present reality. Irrational beliefs may not be supported by empirical evidence in the environment. These beliefs are characterized by thoughts with must and should. That is, things must and should be in a particular manner. Example of irrational beliefs are one should be loved by everybody all the time, etc. So basically, what happens is in this therapy, the therapist interviews the client and tries to see as to where what are some of the psychological distress and what are some of the irrational beliefs behind those, right? And some of the major characteristics to identify these beliefs are your must and should. So, right, if a client is telling you that, I feel that one must be very disciplined or one must be this or one should do this, these might be your tipping points of some of your irrational beliefs. This distorted perception of the antecedent event due to the irrational belief leads to the consequence, that is negative emotion and behavior. Now, if somebody believes that something should always be like this and that thing is not happening, of course, the person would end up feeling negative emotions and behavior because the person feels that he's not able to do what he should or what he must do, right? Irrational beliefs are assessed through questionnaires and interviews. Now, some of the ways into how you can map or judge these irrational beliefs are by using questionnaires or by conducting the interview of your client. In the process of your rational emotive therapy, the irrational beliefs are refuted by the therapist through a process of non-directive questioning. So what happens in the process of your therapy is that the therapist somewhere tries to, discuss these beliefs with the client via non-directive questioning. Non-directive questioning means kind of discussing it in a way but not directing it towards the client. The nature of questioning is gentle, without probing or being directive. The questions make the client to think deeper into his or her assumption about life and problems. Gradually, the client is able to change the irrational belief by making a change in his or her philosophy about life. So the therapist is basically just helping the client realize that it is not a mandate situation to be always to be able to do something all the time, and you're somewhere trying to change the irrational belief that the client is holding so that the person changes his philosophy and he can deal with his day-to-day life in a much better way. The rational belief system replaces the irrational belief system, and there is a reduction in psychological distress. Of course, now when your irrational belief is replaced by your rational belief, or you kind of become okay with the fact that it is not 100%, it is not always it's not always possible to do things the certain ways you want them to do. So you somewhere become okay with them, and therefore your stress becomes little lesser than what you used to be before. Another cognitive therapy was given by Aaron Beck, and his theory of psychological distress, characterized by anxiety or depression, states that childhood experiences provided by the family and society develop core schemas or systems, which include beliefs and action patterns in the individual. So, this cognitive therapy was given by Aaron Beck, and he said that whatever environment you've been raised in, and your family and your society also adds on to your schemas or add on to your beliefs and the action patterns which the individual is building. Therefore, a client who was neglected by the parents as a child develops the core schema of I am not wanted. So he said that because your environment and your parents, how they're affecting you, impacts what kind of things you believe in your adulthood. Therefore, a child who was neglected in his childhood might grow up to believe in the belief that he's not wanted by people around him. During the course of life, a critical incident occurs in his or her life when she or he is publicly ridiculed by the teacher in school. This critical incident triggers the core schema of I am not wanted, leading to the development of negative automatic thoughts. So Aaron Beck believed that somebody who's neglected in the childhood will have a certain schema in his head that he's not wanted. And imagine something very critical happens in his life, when some teacher kinds of scolds him or is publicly ridicules him. So this incident triggers that schema where he believes that I'm not wanted, and therefore this will lead into your negative thoughts. Negative thoughts are persistent, irrational thoughts such as nobody loves me, I am ugly, I'm stupid, I will not succeed, etc. Such negative automatic thoughts are characterized by cognitive distortions. And they've also labeled some of the examples of these negative thoughts, right? And they could be I'm stupid, I will not succeed. And these negative thoughts are also your characteristics of your cognitive distortions, and they show that there is some distortion in how you think about yourself, right? Cognitive distortions are ways of thinking which are general in nature but which distort the reality in a negative manner. Yani everybody thinks cognitive thinking about themselves is a normal human tendency, but if it is distorted, then you know this somewhere distorts the reality of the person in a negative way. These patterns of thoughts are called dysfunctional cognitive structures because they are not helping you, and you're somewhere ridiculing or believing that you're lesser than somebody else. Therefore, these are dysfunctional in nature. They lead to errors of cognition about the social reality. Now, it might be the case that people around you love you, but because you have this cognitive distortion that you're not wanted and people around you don't love you, therefore, you will always have an error of judgment in what the social reality of your life is. Repeated occurrence of these thoughts lead to development of feelings of anxiety and depression. The more you will think about, the more this thought is active, the more you will feel more anxious and more depressed. The therapist, how can a therapist help here is the therapist uses questioning, which is gentle, non-threatening disposition of client's belief and thoughts. So for example, if the client is sitting in front of the therapist and saying that nobody loves me, and I don't feel wanted in my group, or I feel that my friends are not my real friends, so the therapist can ask gentle questions like, but if you think that is the case, then why were you invited to this birthday party? And you told me you had a good time and you enjoyed yourself. So don't you think if people are inviting, your friends are inviting you to their birthday party, so they really want you around? So when the therapist is asking these non-directive questions, which are non-threatening in ways, this helps the client in thinking, okay, the client sits back and think, oh, yeah, that's true. They invited me to their birthday party, so they might just want me around, right? So in this manner, the therapist is gradually trying to persuade or trying to, um, trying to correct the distorted reality into what the reality is in fact true, right? Another examples of such questions would be, why do you think everybody should love you? Why does it mean to you to succeed, right? All of these questions are just ways for the making the client think of these concepts and arriving at a much better place. The question makes the client think in a direction opposite to that of the negative automatic thoughts, whereby she gains insight in the nature of his dysfunctional schemas and is able to alter the cognitive structures. So ye jo questions aap puchte ho, they basically are trying to help the client think in a direction which is opposite to what his distorted beliefs make him think of, right? And this will also help to break the dysfunctional beliefs that he has about himself. The aim of this therapy is to achieve this cognitive restructuring, which in turn reduces anxiety and depression. जितना ज़्यादा ये cognitive restructuring होंगी, जहाँ पे जो आपके negative thoughts हैं वो positive thoughts से replace होंगे, उतना ही ज़्यादा आपकी anxiety and depression कम होगा. Similar to behavior therapy, cognitive therapy focuses on solving a specific problem of the client, in short, lasting between 10 to 20 sessions. बिहेवियर थेरेपी की तरह ही कॉग्निटिव थेरेपी भी क्लाइंट के प्रॉब्लम्स को सॉल्व करने पे ही अपना फोकस करता है. And your cognitive therapy is basically shorter than your other therapies, and the session could last between from 10 to 20 sessions. Another therapy is your cognitive behavior therapy, and this is the most popular therapy presently, right? Research into the outcomes and effectiveness of psychotherapy has conclusively established CBT to be a short and effective treatment for a wide range of psychological disorders such as anxiety, depression, panic attacks, and borderline personality. Yani, what they are saying is that a lot of research has established कि जो आपकी cognitive behavior therapy है वो एक बहुत ही short और effective treatment plan है कुछ for these psychological disorders, which can be your anxiety, panic attacks, borderline personality disorders, right? Your CBT adopts a biopsychosocial approach. Biopsychosocial approach meaning it takes care of three domains: biological domain, psychological domain, and the social domain of a person's life. It combines cognitive therapy with behavioral techniques. The rationale is that the client's distress has its origins in the biological, psychological, and social realms. अब we believe in cognitive behavior therapy कि जो इंसान की problem है वो उसकी biological उससे rise हो सकती है, psychological से हो सकती है, and social से हो सकती है. Hence, addressing the biological aspects through relaxation procedures, the psychological ones through behavioral therapy and cognitive therapy techniques, and the social ones with environmental manipulations make CBT a comprehensive technique which is easy to use, applicable to a variety of disorders, and has proven efficacy. तो ये जो तीन डोमेन्स हैं इनको हम कैसे एड्रेस करते हैं? जो आपके बायोलॉजिकल एस्पेक्ट्स हैं उनको हम रिलैक्सेशन प्रोसीजर्स से एड्रेस करते हैं. वी मेक द पर्सन रिलैक्स बायोलॉजिकली, फिजिकली. जो साइकोलॉजिकल डिस्ट्रेस हैं उनको हम बिहेवियर थेरेपी और कॉग्निटिव थेरेपी की हेल्प से डील करते हैं, एंड जो सोशल है उनको हम एनवायरमेंटल मैनिपुलेशन से डील करते हैं. इन दिस by taking care of all of these three domains, CBT somewhere becomes a very comprehensive, very easy to use technique which helps in a vast variety of psychological disorders. Now, another very important therapy in your chapter, which is the fourth in your chapter, conclusively, is your humanistic existential therapy. We've all covered these concepts where we've talked about humanistic therapies in the previous chapters. So if you want to understand the concept better, you can refer to the previous chapters. Here, we will just be talking specifically about humanistic existential therapy. The humanistic existential therapies state that psychological distress arises from feeling of loneliness, alienation, and an inability to find meaning and genuine fulfillment in life. तो ह्यूमनिस्टिक एग्जिस्टेंशियल थेरेपी बोलता है कि जो इंसान की लाइफ में जितना भी स्ट्रेस है या जो प्रॉब्लम्स हैं वो अराइज होती हैं बिकॉज ऑफ फीलिंग्स ऑफ लोनलीनेस, या फिर व्हेन द पर्सन इज नॉट एबल टू फाइंड genuine true meaning in life, right? And the person feels that no, something is missing in his life and he has not achieved what his life was meant to be. Human beings are motivated by the desire for personal growth and self-actualization and an innate need to grow emotionally. When these needs are curbed by society and family, human beings experience psychological distress. ह्यूमनिस्टिक थेरेपी ये मानता है कि जो ह्यूमन बींग्स हैं वो बहुत मोटिवेटेड होते हैं एंड दे वांट देयर पर्सनल ग्रोथ एंड दे वांट टू बिकम द बेस्ट वर्जन्स ऑफ देयर सेल्व्स, राइट? And they want to grow emotionally, but if the society and the family around you somewhere, you know, stops you from doing this, then this results into your psychological issues or psychological problems. How do we define self actualization? Self actualization is defined as an innate or an inborn force that moves the person to become more complex, balanced, and integrated. That is, achieving the complexity and balance without fragmentation. Basically, self actualization एक ऐसे इंसान की पैदाइशी फोर्स होता है इंसान में जो उस इंसान को मोटिवेट करता है टू कीप, you know, stepping forward in his life and achieving what he believes he was born to achieve. Yani there's always a need of growth in every individual, and self actualization can help you achieve your maximum potential that you have as a person or as a human, right? So that is what your self actualization means. So your humanistic existential therapy says that healing occurs when the client is able to perceive the obstacles to self actualization in his or her life and is able to remove them. यानी एक इंसान तभी अपनी हील कर पाएगा जब वो जो उसके सेल्फ एक्चुअलाइजेशन में जो ऑब्स्टिकल्स या जो प्रॉब्लम्स आ रही हैं उनको आइडेंटिफाई कर पा रहा है एंड उनको रिमूव कर पा रहा है, एंड द पर्सन इज, you know, somewhere what do you say, equipped to remove them. Self actualization requires free emotional expression. The family and society curbs emotional expression as it is feared that a free expression of emotion can harm society by unleashing destructive forces. One of the ways to acquire self actualization is also by expressing yourself as freely as possible, but a society generally doesn't allow this, right? Therefore, the therapy creates, yeah, so to cater to this problem, therapy, what does it do? It creates a permissive, non-judgmental and accepting atmosphere in which the client's emotion can be freely expressed and the complexity, balance and integration could be achieved. The fundamental assumption is that the client has the freedom and responsibility to control his or her own behavior. The therapist is merely a facilitator and a guide. It is the client who is responsible for the success of therapy. The chief aim of the therapy is to expand the client's awareness. Healing takes place by a process of understanding the unique personal experience of the client by himself or herself. The client initiates the process of self-growth through which healing takes place. So because we said that, you know, self actualization happens when there is free emotional expression, so to facilitate that, the therapist creates an environment which is non judgmental and the client is able to freely express himself emotionally and somewhere identify and arrive at a place where he is able to, where he reaches a stage where he's so much aware of what he wants and what he wants to do, and this somewhere helps him in achieving self actualization, right? And the therapist here is merely a guide. The chief person who's taking the action is always the client and not the therapist. Another therapy which exists in your chapter, in your course, is your existential therapy. This was given by Viktor Frankl, a psychiatrist and neurologist, propounded the logotherapy. Logos is basically the Greek word for soul, and logotherapy means treatment for your soul, right? And Frank called this process of finding meaning, even in life threatening circumstances, as the process of meaning making. Yani he says that if you're trying to find meaning, even in your life threatening circumstances or situations which are very difficult, then this is the process where you're making meaning out of it. The basis of meaning making is a person's quest for finding the spiritual truth of one's existence, right? Existential therapy basically means what is the reason behind, it tries to find out what is the reason behind why you're existing. So, existential therapy. Neurotic anxiety is arise when the problems are of life are attached to the physical, psychological or spiritual aspects of one's existence. यानी he says that neurotic anxieties उन्हीं चीजों से arise होती हैं जब your problems हैं, they are attached to your physical, psychological and spiritual aspects. Frank emphasized the role of spiritual anxieties in leading to meaningless and hence it may be called an existential anxiety. He also said that if if an individual has spiritual anxieties, then that will lead to meaninglessness in life and will lead to your existential anxiety, right? The goal of this therapy is to help the patients to find meaning and responsibility in their life, irrespective of their life circumstances. So, the goal of this therapy is to help people in finding out as to what is the meaning for their life, irrespective of what circumstances they are in. The therapist emphasizes the unique nature of the patient life and encourages them to find meaning in their life. In logotherapy, the therapist is open and shares his or her feelings, values, and his or her own existence with the client. The emphasis is on here and now. Transference is actively discouraged. The therapist reminds the client about the immediacy of the present. The goal is to facilitate the client to find the meaning of his or her being. So basically, this whole therapy is the whole goal of this therapy is to help the client find meaning in his life. And this can also be done by the therapist sharing his experiences, and transference is discouraged, right? And the focus is always on the present and in finding out as to why the individual exists and what is the meaning and purpose of his life. Another important therapy which is there in your syllabus is your client-centered therapy. We've already covered this therapy and we know that this was given by Carl Rogers. Rogers combined scientific rigor with the individualized practice of client-centered psychotherapy. Rogers brought into psychotherapy the concept of self, with freedom and choice as the core of one's being. The therapy provides a warm relationship in which the client can reconnect with his or her disintegrated feelings. So basically, in this therapy, what happens is that this therapy is very focused on the client, and therefore the name client-centered therapy. And here, the two important things to remember are that the therapist shows empathy and has unconditioned positive regard. So, the therapist tries to empathy basically means when the therapist tries to, keep himself in the client's shoes and feel as to what he's feeling, and provide an unconditional positive regard, which is basically making sure that no matter what the condition is, the therapist always have a positive attitude and a positive regard for the client, and that should not be based on any condition. The unique unconditional warmth ensures that the client feels secure and can trust the therapist. The client feels secure enough to explore his or her feelings. The therapist reflects the feelings of the client in a non-judgmental manner. The reflection is achieved by rephrasing the statement of the client, that is, seeking simple clarifications to enhance the meaning of the client statement. This process of reflection helps the client to become integrated. Personal relationships improve with an increase in adjustment. In a sense, this therapy helps a client to become his or her real self, with the therapist working as a facilitator. The focus is completely on what the client wants to achieve, and the therapist is just there, present there, providing empathy and unconditional positive regard and trying to achieve the aims of the client. The last is Gestalt therapy, and in German, the word Gestalt basically means whole. This therapy was given by Frederick Perls together with his wife Laura Perls. The goal of this therapy is to increase an individual's self-awareness and self-acceptance. The client is taught to recognize the bodily processes and the emotions that are being blocked out from awareness. The therapist does this by encouraging the client to act out fantasies about feelings and conflicts. The therapy can also be used in group settings. Here also, the aim of the therapy is to have the client become very aware of what he wants and express his emotions and feelings as freely as he wants. And in fact, to act out his fantasies about feelings and conflicts, right? And this is one therapy which can also be used in your group settings. Another is your biomedical therapy, and here medicines may be prescribed to treat your psychological disorders. Prescriptions of medicines for treatment of mental disorder is done by a qualified medical professional known as psychiatrist. They are medical doctors who have specialized in the understanding, diagnosis, and treatment of mental disorders. So basically in biomedical therapy, there is involvement of medicines which are prescribed by your psychiatrist, right? And severe mental disorders such as schizophrenia or bipolar disorders require antipsychotic drugs. The medicines prescribed to treat mental disorders can cause side effects which need to be understood and monitored. So these medicines can also lead to some side effects which should be understood and monitored by a medical health professional. Hence, it is essential that medication is given under proper medical supervision, right? Another part of your biomedical therapy apart from medicines is your electroconvulsive therapy or your ECT. And in this, mild electric shocks is given via electrodes to the brain of the patient to induce convulsions. The shock is given by the psychiatrist only when it is necessary for improvement of the patient. In fact, this is very debate worthy in these times, and it is not encouraged that your electroconvulsive therapy is used. ECT is not a routine treatment, like I mentioned, and is only given when drugs are not effective in controlling the symptoms of the patient. In case the case is very severe and medications are not working, then only it's advised that ECT might be used, and this should also be done under the supervision of qualified medical professionals. The last topic in your chapter is factors contributing to healing in psychotherapy, right? What are some of the factors which enable quick healing in a psychotherapy process? So these are several factors. A major factor in the healing is the techniques adopted by the therapist and the implementation of the same. So which technique is being chosen and which technique is being used and how well is it implemented, is it being implemented on the client also impacts how quick the healing will be. Another important factor is the therapeutic alliance. So by therapeutic alliance, we means this therapeutic relationship which is being built between your therapist and the client, right? Because this also becomes a very important factor, and what is the availability of your therapist, how warmth, how much empathy does he have for you, this also impacts the how quick the healing or how the healing process will look like. At the outset of therapy, while the patient client is being interviewed in the initial session, to understand the nature of the problem, she unburdens the emotional problems being faced. This process of emotional unburdening is known as catharsis, and this itself also has healing properties. So suppose if when the client is sharing his problem and he unburdens all the that he has on the therapist, this process of unburdening your emotions is known as catharsis, and this also has healing properties within itself. There are several other non-specific factors associated with psychotherapy, and some of those um, could be client related or client or patient related, which could be your motivation for change, expectation of improvement, and the variables related to your patient are known as patient variables. Other non-specific factors which are therapist related could be your positive nature, absence of unresolved emotional conflicts, presence of good mental health, etc. And these variables which are concerned with your therapist are known as variables. Now, some of the ethics which should be followed in psychotherapy are, and these are your ethical standards that need to be practiced by professional psychotherapists. First is your informed consent needs to be taken. What do we mean by informed consent is that before the client signs up for therapy, you have to tell the client as to what all will be a part of this process of psychotherapy, and he needs to give his consent and he needs to agree to going through this process, right? Another important ethic is your confidentiality of the client. Whatever is being shared in the sessions in therapies or whatever the client is sharing with you should be kept confidential, right? And you should not share it with anybody else who's outside of the medical health fraternity. And when you can share it with another mental health practitioner also is listed, and there are certain rules and standards that you have to abide by as a psychologist. Elevating personal distress and suffering should be the goal of all attempts of therapists. So the therapist should always work towards, reducing the stress and suffering of the client. Integrity of the practitioner-client relationship is important. Having that integrity between the practitioner and the client is of utmost importance. Respect for human rights and dignity. You should respect each other mutually, and you should respect the rights the client has as an individual. And the last ethics in psychotherapy would be that professional competence and skills are essential, right? You have to have those skills and that competence to be able to help your client. Otherwise, it falls under your it falls or it goes against the ethics of psychotherapy. Now, apart from this, there are some alternative therapies which are also available, and they are called alternative therapies because these are apart from the conventional drug therapy or your psychotherapy. There are many alternative therapies such as yoga, meditation, acupuncture, herbal remedies, and so on. I will not be covering these in detail. You can go through these in the NCRT book, and these are pretty easy to understand, right? So whether it is your yoga, meditation, Kundalini yoga, these are all the ones that you will be able to read and understand from the book itself. So I'm not covering this in detail here. Then the probably the shortest topic is the rehabilitation of the mentally ill. The treatment of psychological disorders has two important components. First is reduction of your symptoms and improving the level of functionality or quality of life. In the case of milder disorders, what happens in, for example, in generalized anxiety, what happens is um, the reduction of symptom is associated with improvement in quality of life. तो जहाँ पे जो केस है वो कम सिवियर है, वहाँ पे क्या होता है, जैसे ही symptoms कम होते हैं वैसे ही quality of life अपने आप better होने लग जाती है. On the other hand, in some severe mental disorders, for example, such as schizophrenia, reduction of symptoms does not mean that the quality of life will improve. Many patients suffer from your negative symptoms, such as disinterest or lack of attention or motivation to work and interact with people. For these people, which have severe disorders and which have severe disorders and where reduction of symptoms is not leading to improved quality of life, rehabilitation becomes very important, and it is required for such patients, right? The aim of rehabilitation is to empower the patient to become a productive member of society so that he's able to contribute something to the society. In rehabilitation, the patients are given occupational therapy, soft skill training, and vocational therapy. So if the person is not able to cope up with the quality of his life himself, then the person is recommended for rehabilitation. And in occupational therapy, the patients are taught skills such as candle making, paper bag making, and weaving to help them to form a work discipline. So by doing these small things, we are trying to build a little work discipline in the severe mental health patients. Social skills training helps the patients to develop interpersonal skills through role play, imitation, and instruction. The objective here is to teach the patient to function in a social group, because once these people have severe symptoms, they somewhere become very alienated from the society, and therefore this rehabilitation process helps them to enter the society in a similar manner. Cognitive retraining is given to improve the basic cognitive functions of attention, memory, executive functions. After the patient improves sufficiently, vocational training is given wherein the patient is helped to gain skills necessary to undertake productive employment. So this was the last topic of your chapter, rehabilitation of the mentally ill. With this, we've covered chapter 5. In case you have any suggestions, any advice, anything else that you would want me to include in these chapters, please feel free to comment down your suggestions, and I will definitely try and have them in the next videos. Also, everybody who would want to have the notes that you see on the slides, you can comment down your email ID, and I will make sure that the notes reach you on your mail ID within 5 to 10 days of doing that. Apart from this, I am planning to be more consistent with these videos because life has been pretty busy for the last 1 month, so I've not been able to regularly put videos up on the YouTube channel. But as things have calmed down a bit, I am sure that we'll be able to cover all the remaining chapters in given short time. So thank you so much. Do give me your feedback as to what you felt. Thank you so much. I will see you in the upcoming videos.